I'm pleased to be here with my colleague from New Hampshire, Senator Hassan. But I'm not pleased to be talking about this topic. People are dying every day in New Hampshire and across the country, and the administration continues to pay lip service to the opioid crisis. We need action, not more empty promises. We need a federal response that matches the national public health emergency that we are facing. That's why Senator Hassan and I are proposing that leadership include $25 billion to address the opioid epidemic in any final budget package. Recently released data from the CDC confirms that New Hampshire has the third worst overdose death rate from substance abuse of any state in the country. Furthermore, the CDC report showed that in 2016, 42,000 people in America died of drug overdoses. And they also confirmed that this is a crisis that has spread so fiercely that it has reversed the positive trend toward longer life expectancy for the second year in a row, the first time that this has happened since the 1960s. So make no mistake, this is a national public health emergency, and we still don't see a robust federal response. In 2014, Congress provided $5.4 billion to address Ebola, and we hadn't lost one American. The current federal budget negotiations give us an opportunity to right this wrong. The additional $25 billion that Senator Hassan and I are proposing over 2 years would bridge the current gap between the domestic and defense budget numbers that negotiators are talking about. This parity between domestic and defense priorities is something Democrats have been adamant about during this budget debate. And by the way, it's something that we actually agreed to when we put in place the Budget Control Act of 2011, that there was going to be parity between the defense and the domestic side of the budget. So it's important that as we budget for the defense of this nation, we don't short shrift our domestic needs, particularly something of the magnitude of this opioid epidemic, which is a direct threat to every community in this nation. Make no mistake, $25 billion would help save lives because treatment saves lives. Our proposal for treatment funding is in line with what President Trump promised to do when he was campaigning in New Hampshire and throughout his campaign, and it's what he's promised to do since becoming president. Provide much-needed federal assistance for both treatment, prevention, law enforcement to help end this epidemic. This is a proposal that can gain bipartisan support because, as we have seen in the past, addressing the opioid epidemic is not a partisan issue. Talk to people in those states that are hardest hit, in West Virginia, in Ohio, in Maine, in New Hampshire. Everyone knows someone who has been hit by this epidemic, and they tell stories of broken families, of lives cut short, of devastated communities. This is a place where we can come together, Democrats and Republicans. We've done it before. We've showed that it is a funding solution that can help resolve our budget crisis. I urge our leaders to act. Senator Hassan.
Thank you. Well, thank you, Senator Shaheen, and thank you all for being here today. As Senator Shaheen said, New Hampshire and states across the country are grappling with the challenges of a truly devastating heroin, fentanyl, and opioid crisis. And we are seeing tens of thousands of Americans being lost to drug overdose deaths. The spread of synthetic opioids like fentanyl is making the crisis worse, killing people faster with much smaller amounts of drugs. And in both of the last 2 years, American life expectancy has decreased, in large part because of the opioid crisis. It's a crisis that doesn't discriminate. It affects people in every community and from all walks of life. It's something I hear about everywhere I go in New Hampshire and actually across the country. And I don't just hear about it from families where a loved one is struggling with addiction or a family who has lost a loved one to an overdose. I hear about it from employers. It's taking a massive toll on our workforce, and as the White House's own economic advisor acknowledges, on our economy. When I talk to those on the front lines in responding to this crisis in New Hampshire, I consistently hear that they need more resources to support this fight. They're doing so many creative things at the grassroots level, whether it's firefighters in our Safe Stations programs, or whether it's police departments assigning a police officer to be the point person on this crisis. They need the resources to do their jobs and to save lives. So Congress has to come together and put partisan politics aside to get this done. Negotiations on a long-term spending bill provide an important opportunity to address the urgent need to increase federal funding and make investments in key programs to combat substance use disorders. In New Hampshire and in states across the nation, families and communities are hoping and calling for a budget agreement to include a significant increase in funding to address this epidemic. Senate Democrats are fighting for a budget agreement that includes an additional $25 billion to combat the crisis. It would support treatment, recovery, prevention, and law enforcement efforts. I'll push to ensure that the hardest hit states like New Hampshire are accounted for with the appropriate amount of funding. It's going to take, by the way, a far greater federal investment to help support those on the front lines and to turn the tide of this epidemic. But providing an additional $25 billion now is an important first step that we really must take. The purpose of this funding bill is to ensure the safety, security, health, and well-being of our citizens and our country. The opioid crisis is the greatest public health crisis facing our country, something that members of both parties just acknowledged in a Help Committee hearing I left just a few minutes ago. We can't afford inaction. We need to get more resources to those on the front lines of this crisis and to those who are struggling to get the treatment they need. We need to save lives. Thank you.
Thank you. We'd be happy to answer questions. Yes.
A lot more money than you guys have put forward in the 21st Century Cures Act 2 years ago now for the same period of time. Why do you think so much more money is needed on this right now?
Well, because we haven't seen the results that we were looking for. The fact is, when the Republicans put forward their last health care proposal, it included $45 billion to address the opioid epidemic. So we think this is a reasonable sum, and it's a sum that can help us as we're trying to resolve the budget, the disparities between the defense and the domestic side of the budget and the budget crisis that we're facing.
This is also a number that a member of the President's Commission on this epidemic put forward as an initial and important amount of money. One of the things that we just heard about in our Help Committee was the need to provide infrastructure for the grassroots and state-level programs to combat this crisis, and the understanding that this is a long-term crisis. It took decades for us to get to this point. Experts tell us it's going to take years for us to truly turn the tide and beat this epidemic. That requires investment in ongoing infrastructure and building that infrastructure out. So we knew that the first $1 billion was a very important amount, but that it wasn't going to begin to really provide the kind of infrastructure that we need over the next multiple years to combat this crisis.
Thanks, Senators. Lisa from the PBS NewsHour. I had a question going the other direction, which was about the $45 billion. And just months ago, there was so much pressure, so much talk about a major funding initiative. But yet, we see just you two senators here talking about this. Obviously, there are many issues going on right now. But can you talk about, has there been a change in the conversation at the Capitol with pressure from the outside? What's happening? Obviously, we've seen some reports that opioid deaths are down, but really not by that much. What's happened with this issue that it's not the headline that it was?
Well, I think there are a lot of other headlines these days, but make no mistake, it remains the issue that it has been. And one of the important things to remember is that the funding is really critical, but what's also critical is maintaining the Affordable Care Act and the access to Medicaid expansion and health care that's available through the ACA. So when we were having the debate about the $45 billion, it was because they were talking about rolling back the Affordable Care Act. So, as Senator Hassan says, this is a down payment, but we think it's an important start, and it's one, again, that can help us get where we need to go in terms of resolving the budget crisis.
And Senator Shaheen and I joined with senators from other parties on a letter that didn't specify a number, but showed bipartisan support for including more funding to combat this crisis in this end-of-year funding agreement. I will tell you that it has not moved off the radar screen of the people of our state. It is the #1 priority for every single Granite Stater who I talk to. It is devastating families and communities. It cost our economy in, I think it was 2014, about New Hampshire's economy, $2.5 billion. It's costing the national economy, according to the White House, about $500 million a year. Sorry, billion.
Million.
Yeah.
Yes.
Kimberly Leonard from the Washington Examiner. Do you have support from other Democrats for this specific funding amount?
We're building that as we speak, so.
Is this the first formal ask that's been out there in terms of?
Well, there have been behind-the-scenes negotiations as well.
Yeah.
Can you speak from, you're talking about the funding bill, you're talking about the budget cap bill,
Yes.
the long-term bill you're talking about, not whatever, if there's a CR or whatever they do.
Right.
Yes, hopefully it will not just be a CR.
Yeah, hopefully it will not just be a CR.
Yes, you had a question.
Oh, yeah, I'm sorry if I missed it, but how much have you reached out to the White House and got the Trump's backing on something like this?
I have not talked to the White House,
And neither have I.
so, well, thank you all. very
Thank you.
much.